An overuse injury is something that we're seeing that's more on the rise right now, and essentially it's just overloading of the tissues of the body. So when we talk about muscle, tendon, ligaments, and in children we're really specifically concerned with growth plates. Youth athletes are experiencing these overuse injuries now at a higher rate than they ever were before, and a lot of it is just due to too much time on the field, combined with bodies that are not yet ready to take on this kind of force. Common injuries that I see in kids have some typical pain patterns. They complain of heel pain, knee pain, low back pain, hip pain. If your child is really dedicated to their sport, there's a few things that I can recommend. One is to try to make sure that they're diversifying. So even if they really want to be playing for a travel team, for soccer, for example, making sure that they're not getting above those 10 hours of practice per week, making sure they get enough diversification. Maybe one day they're going to go for a swim in the pool as opposed to being on that field. They also need adequate amounts of rest, and by rest I mean actual sleep. Children are still growing, and while they are sleeping, their bones and their tissues can heal and repair. Another piece of advice I can offer is to make sure that your coach and your team incorporates an adequate warm-up and cool down. This will help prevent many of the injuries that we do see on the fields. And lastly, you should seek out the services of a physical therapist. First and foremost, the PT is going to help in the education piece with the parent and the coach and the athlete and let them know why the injury may have happened. The physical therapist can also really help with the current injury and further prevention of injuries that may happen down the road by specifically working on your child's cardiovascular fitness, their muscular strength, their endurance, and their coordination and agility to get them back onto the field in a safe and timely manner.